Hey YouTubers, it's Dr. Alessandro. Welcome back to my channel. Please like and subscribe. In today's video, I'm going to be talking with you a little bit about the effects of smoking. Now, I know you've probably all heard about how bad it can be for the lungs, and it can cause lung cancer and emphysema and all sorts of other diseases that really are bad for the lungs. But we're going to talk about smoking and its effects on the mouth. Something that maybe isn't quite thought about as much. So what can smoking do? One thing that smoking can do is it can, of course, stain your teeth. Now, that's probably actually, of all the things that it does, the least damaging. But when people smoke, their teeth are typically stained more of like a yellow-brown. And so, depending on how much smoking is done. So that is definitely something that can happen and that is pretty visible. So that's one thing that can happen. Now, other things can happen, and they're a little bit more dangerous. So first off, smoking can also cause our salivary glands, especially the small ones that we have. We have many tiny salivary glands in our mouths, not just big ones that are right behind the lower front teeth or out by the sides of our upper back teeth, but we have other salivary glands, very tiny ones, that do a lot to contribute to our salivary flow. Well, smoking kind of kills them off. So it basically causes them to slow down a lot, maybe even stop working altogether. And what that does is it dries up our mouth. Well, as you know, a dry mouth, from one of my previous videos, can lead to a lot of problems, including increased cavities, and it can really cause a lot of harm that way. So that's one thing that smoking can do that we don't really think much about, but it definitely happens, and we see the effects. Now, smoking also slows down our immune system. So it slows down the white blood cells. So why is that important? Well, it's important in a couple of different things. It's important for the gums, as you know, because when we have gum disease, if our white blood cells aren't working quite as well as they could, infections can happen more easily, and the progression of gum disease and infection can happen much more easily, and it can actually accelerate or go faster if somebody is smoking. So that's another thing that can happen. Yet another thing that can happen is, since the white blood cells are being impeded, well, healing after things like extractions is slowed down. And that's true for any part of the body, healing from any kind of surgery if you're a smoker, but especially, say, from a tooth extraction. Healing will go a lot slower. And that's obviously a very bad thing, because you really want things to heal up as quick as possible. Finally, tobacco use, especially smoking, can increase your chance of having mouth cancer. That's a really bad thing. Mouth cancer is a very real phenomenon. It might not be terribly common, but it is very devastating. And if you don't really know what's going on and there are no symptoms, it can actually progress pretty quickly to a point where it's either going to require significant treatment, including pretty radical surgery to get rid of it, or it may become fatal. So, smoking is obviously a very bad thing for the lungs, but this adds to it. And so we just ask that people try to quit as best they can. So that is it for this video. Thank you so much for watching, and hope you're all staying healthy and well.